Hello, my name is Hannah. Ethics is the moral principles that deal with a person's knowledge, behavior, and activities. Some of the important features of ethics that I have learned so far is the preeminence of reason, which involves or requires critical thinking. I believe that if harming someone is wrong in a particular situation, then harming someone would be wrong for anyone in a relatively similar situation. Now, of course, everyone's going to have different situations, but when it comes down to it, if we are in the same situation, I believe there should be no harm. I am not a fan of violence. This has been very helpful because I now think before I act or speak on a topic. I am also very careful of my actions and my first response to these topics of discussion. I now do my research if I feel uneducated about a topic and I try to understand the other person's point of view. I also try to keep myself out of harmful or dangerous situations. I also feel the principle of impartiality is important because it covers the welfare and interests of other individuals. Impartiality also is based on decisions on objective criteria rather than on being biased, the prejudice, or preferring to the benefit of a person over another for improper reasons. So I'm not a fan of racism. I do not like homophobia. I am, uh, it, it boils my blood a little bit. I will continue on. The saying, treat others as you would like to be treated, is a moral code I have lived by my entire life. I believe that if you judge someone based off of their religion, their color of their skin, their body weight, what they decide what to believe in and what not to believe in, I think that is very wrong because you are judging them based off of what you think is right. And that to me is not okay. You should get to know a person no matter what background they come from. Understanding ethics will help me in my future career because in the medical field of ethics, we will examine specific problems, then use values, facts, logic, best of choice, like best of our opinion, best of choice, etc., to decide what treatment is best for the patient. My future career is in nuclear medicine technology. I will be injecting a needle into someone's arm, and that then will it will go through their body and it will let me then take a picture of the certain organ we will be looking at for that person. Knowing about the field of ethics can help me determine what is right and wrong. Right and wrong as in if I'm looking at the right organ, if this person should even be going under nuclear medicine if something is like very wrong. Also if they had consent to do this, if they did not. If I should or should not be treating the patient in a certain way, if I should have given them a different medicine, if I should have done this procedure first, stuff like that. Ethics has also taught me to slow my thinking process down and look at all the possible solutions to provide the best possible care for my patients. And I believe that is very important because every person is different. Every person is going to act differently to the injection. Every person's going to have different organs that need to be looked at and then what's wrong. So every single time, you have to look at the individual and understand that they're different from your patient before. So thank you for listening to my presentation.